All right. Good morning, everyone. Good afternoon, good evening, depending on when and where you're watching this Facebook Live. This is the voice and the face of Dr. Tolu Olabinto. I'm the CEO and co-founder of Living Spring Family Medical Center here in the awesome city of Mansfield, Texas, where we
Yay!
help our patients live longer and well because we believe the quality of life is just as important as the quantity of life. And I'm really excited because today we're having conversations that help with that whole our slogan when it comes to mom and baby. And so I am honored to have with us today Dr. Cindy Rubin. And we'll be having the conversation. Doc, I heard breastfeeding is hard. Can we bust the myth or the myths? So Doc, thank you so much for coming.
Thank you for
I
having me.
thank you for coming this early in the morning to share your wisdom with our viewers. And how are you doing?
I am doing great. I am doing great. Thank
Awesome.
you.
Awesome. So now, if you don't mind, kindly introduce yourself. Who are you and what do you do?
So I am Cindy Rubin. I am a pediatrician and a breastfeeding medicine specialist, which is a physician who is providing physician level care of breastfeeding issues, because it is hard to find a physician who really has any training or knowledge of the more complicated stuff going on with breastfeeding. And I am in Chicago, and I have my own little tiny micro home visit practice.
Wow. You downplay that a little. She has her own direct pediatric care practice called Touch Pediatrics and Lactation. In addition to what she said, she continues to be involved in teaching medical students as the advisor for her breastfeeding and lactation fourth year elective. So you're really big on this, on what you do, and it's very, very important what you do. She also serves as the co-chair for the Committee on Breastfeeding for the Illinois chapter of the American Academy of Pediatrics, and she's a board member of the North American Board of Breastfeeding and Lactation Medicine. I wasn't going to downplay all of that. Because you're a big advocate for what you do, and I wanted to highlight that because you come here not just as a breastfeeding specialist, you're an expert in the field, and you're very big on pushing that agenda. So thank you for what you do.
Yes. Thank you. Thank you. You are welcome. I think it is very, very important, and it's just important to further women's health that has been largely ignored in this country, unfortunately.
Yes, ma'am. Yes, ma'am. Now, inquiring minds want to know, why do you do what you do? What's the story? Is there a story behind that? Why?
Yeah, I mean, there's a couple whys. One is that I had my own problems when I was breastfeeding and realized that I didn't know anything. And even once I had kids, I was better able to help my patients, but still only based on my own experience. So I wanted to really learn the whole shebang so that I could help people better in the moment when they really needed it. So that's why I started to get interested in breastfeeding. And then my second why is that I became completely burnt out in the system,
Mm.
trying to do all of this. And I discovered Direct Primary Care, which is a membership-based model that allows you to have smaller panels and therefore more time with your patients. And that is what I have found actually works for me and allows me to spend the time that I need to.
I love it. I love it. And I see this theme a lot in having conversations with my guests, that it's a pain point that you went through that you help others address. So that
Yeah.
way and it makes you a better advocate because you know what your clients feel like.
Yes.
Now, so my first question is this: why breastfeed? Feed now, and the focus here is what's in it for the mama, because we
Mhm.
know breastfeeding is good for the baby and all of that, but it's like what's in it for the mamas?
Mhm. So there is a lot. So, there's direct breastfeeding at the breast and there's pumping. So they both have potentially slightly different benefits. But in the very beginning, breastfeeding helps you to release oxytocin, which helps the placenta or not the placenta, but the uterus to clamp down, and for bleeding to help bleeding to resolve. So that is a true physiologic way in which those processes are linked. But there's also some more long-term benefits. So there is a lower risk of breast and ovarian cancer to women after they have lactated, a lower risk of heart attack, and a lower risk of type 2 diabetes. And there's a certain amount of bonding and connection that can happen between you and your baby as well when you're breastfeeding.
Awesome. Awesome. And now let's shift a little bit. What's in it for the baby? We know, it's source of food, but what are other things you say that's in it for the baby? And the reason I'm asking this question is to sell people on their why. Like,
yeah,
this is why it's good for you as the mom, and this is why it's good for the baby.
Yes. So lots of benefits. So there is proven to be less incidence of diarrhea illness, gastroenteritis. So like norovirus is running rampant in the United States right now, I think. And it can protect babies against that. Less otitis media, which is ear infection. Less leukemia, so it can actually help to prevent cancer, which is pretty amazing.
Awesome.
Fewer complications from colds, protective against SIDS, sudden infant death syndrome, which has a new name now, but I think most people out there know what SIDS is. Less obesity and less type 2 diabetes. And it's interesting because the ear infection risk is actually lowered in babies that are directly nursing at the breast more than babies who are lactating. Are pumping and giving their milk by bottle. There is some decrease in the otitis media because there is a decreased cold, decreased number of colds. But it actually helps otitis media because of the oral motor process going on and the positioning of your jaw and the formation of your palate and all of those bones and muscles in your face when you're directly nursing. So it's very interesting that is, I think people think of it more as the milk that's doing it, but it's actually the way you are eating. Helps.
Right, because with the bottle, the milk kind of comes out like really easy. With this one, you actively have to suck, so you move those muscles. Wow, very good.
Exactly.
I didn't know that. And then the leukemia part, that's a big deal. That's big. I mean, everything else is big, but that's really, really important to note.
Yes.
Now, so I have someone who's watching who's thinking, well, I mean, I hear the horror stories about breastfeeding because bad news sells. And someone who's watching who's like, well, how do I prepare to be a very good breastfeeder? That's a word. How do I prep for it? What would you say, Doc?
I think the biggest thing is going in with expectations that are realistic, because many people do struggle. There can be, it's a skill. It's a skill that mom has to learn. It's a skill that baby has to learn. And even though we think of it as the most natural thing in the world, it does often present some challenges. And so just going into it, knowing what you are hoping for, but also understanding that it may take a while to get to that, or you may need to change your expectations or your view of how you're going to do it over time. You may not need to, but you may need to. The other thing is to have your support system ready. So I think having a lactation consultant lined up, and if you've had problems before with lactation, or you have, let's say you've had surgery on your breast, or you have a chronic illness, or I'm trying to think of the other things that would make people put them at a little bit more risk for having complications. If you have a history of infertility, there is some increased risk that there will be some complications with breastfeeding. And so if you know that you have those underlying conditions, then reaching out to somebody for a prenatal consult can be very helpful to help you to figure out how to maximize your success. And there's no reason why somebody without those risk factors can't do the same.
Right.
It's just a little bit more important maybe for those people with underlying issues.
Okay. So have realistic expectations, ask questions, get your support systems in place. It may take more effort to get the same result, but getting those things ahead of time can help better prepare you for it.
Exactly.
Very good to have a lactation specialist too, who would, like Dr. Rubin, who would help champion you through the season. Okay.
Yes.
Yes. All right. So let's go right to the myths. So the first one is it hurts. The idea of it, like, ouchie. What would you say to that, doc?
Yeah. I mean, in fact, I see a lot of that because, women who do have pain end up eventually seeking out help. But yeah, so, well, a couple of things. So it's natural and normal to feel a bit of discomfort. This is a very new sensation on your nipples, which are a very sensitive part of the body.
Right.
And in fact, need to be sensitive for the right signals to get to your brain to make the milk. But it should not hurt. And your baby is also learning how to do this and learning how to use their tongue and their mouth and their jaw and to draw that milk out. And sometimes in those initial moments and those initial latches, it may hurt because you haven't quite figured out the right position. So if it hurts, if it truly hurts, and you're like curling your toes kind of pain, something's not quite right. And then you need to seek out some help, whether if you're in the hospital, just asking your nurse or the lactation consultant at your hospital, or if you're at home, asking your midwife or your doula or whoever you have with you to help you to maybe figure out some different positions and find something that is less painful. Now, sometimes no matter what you do, it continues to hurt, and then that has to be investigated as well. So, if done, if everything is matching up, it should not hurt, at least after those first few days, and sometimes those first few moments. Sometimes the first couple of moments of breastfeeding can hurt just because the nipple needs to extend to reach the right place in the baby's mouth, and that takes a few seconds. But again, even that, most people describe as kind of uncomfortable, but not necessarily toe curling pain. So toe curling pain, it's not, something's not right.
Okay. So yes, some discomfort is a new feeling. It takes a few minutes, seconds to maybe days to get used to, but it is still possible to transition from that point. And if it hurts, you should definitely get someone to look and investigate that.
Yes.
Next myth. It will flatten my boobs. That's how it's quoted. So
I know. Well, I think some of it is also all in perspective because your breasts actually enlarge usually during pregnancy and during lactation. And so then when lactation is over, then the breasts do a certain amount of shrinking, but not necessarily beyond what they were originally. Our bodies change over time, and I don't know that all of that is due to breastfeeding per se, but people definitely notice differences after lactating. And there's different ways to look at that. Yes, there's the aesthetic part of it that may be different, but then there's also the reminder of this very special thing that you did, which may be more of a priority and something that you can remember, and just to understand that with the seasons of our lives, our bodies do change, but that is part of the process.
That is part of the process. And I love how you change your perspective on, you can choose to see that as a reminder that this was a phase in my life that I got to spend with my child, or something to be really concerned about. And I wanted to highlight what you said, that it's going to flatten the shag anyway, like breastfeeding or not.
Right.
So yeah. So worth it, in my opinion. All right, next myth. It's all or nothing. If I don't truly fully breastfeed, then I have to give just bottle. I can't do both. It's all or nothing. What would you say to that, doc?
Definitely not true. So thank goodness there is formula for the times that we need it. It is life-saving. And sometimes you may choose or need to use formula in part. There is no reason why, if you're not making quite as much milk as your baby needs, that you can't supplement with formula but still give breast milk. There's no reason that you can't, just choose to breastfeed part of the day and give formula the other part of the day, if that's what works for you and your family. So, and what works may change over time as well. So there's definitely not all or none. There's so many different ways to do breastfeeding. We actually call it now, it has a name, it's inclusive breastfeeding instead of exclusive breastfeeding, inclusive. There are many, many different ways, and they're all okay.
I love it. You do what works best for the season you're in. You can combine inclusive breastfeeding. I love that. Next myth. It's going to be hard to breastfeed because I'm going to work.
Yeah.
So
this is a tough one, and I can't say in truth that it's not hard. It does add some additional challenges, but it's not something that you cannot do. And in fact, there are laws in this country that protect women's rights in the workplace to be able to pump milk safely and comfortably with the breaks that are necessary. And they're not perfect. I wouldn't say that they're perfect yet, and not every employer implements them perfectly, but you do have rights. But it's challenging. If you've been home for 3 months and exclusively nursing at the breast, and then suddenly have to switch to pumping, which is not necessarily quite as fun, then that's hard. And I won't lie, it is hard. It's a difficult road to manage that, but it can be done, and many women do it. And this is, again, where you have to decide where your priorities are, what you have the physical and emotional and mental capacity for at that particular time, and figure out what works for you.
And I love that you highlighted also that there are laws in place to allow for this. Very, very important. So you don't feel, that what you're asking for is unreasonable. All right,
Yes.
ask for what you need. Very, very important, even at work. Doc,
Yes.
I have a question live, and someone's asking the use of medications. Said, did we discuss the uses of domperidone yet? My breastfeeding journey has always been hard. My baby is 5 months old, and I would like to relactate. What would you say to someone asking that question, Doc?
Yeah. That is absolutely something that can be done, and especially if you were previously lactating and producing
Good amount.
milk, not really struggling with your production, then you quite probably can relactate. And if your baby is interested, then sometimes just putting your baby back to the breast is all you need. It kind of depends on how long it's been since you've been breastfeeding. Sometimes it is really hard in the beginning, and you kind of decide that it's not working, but then later you want to give it another go. And so you may not know whether you have that full production or what it's going to be like you relactate. And if that's the case, I would absolutely reach out to a breastfeeding professional of some sort, either an IBCLC, a certified lactation consultant, or a breastfeeding medicine specialist. And the benefit to a breastfeeding medicine specialist is that a physician, is that we can prescribe medications if they're needed. So you asked about domperidone, and that is something that is not FDA approved in the United States right now. People are working very hard at changing that. But this is a medicine that can help to increase prolactin. And there are a couple of medicines that are FDA approved in the United States that can do the same, but have a lot of side effects. So domperidone, in many ways, can be preferable, and it is legal to use pretty much everywhere else in the world except for the United States right now. And Canadians use it quite a bit for lactation, and it is definitely something that if you're a while out from breastfeeding, it may be helpful to help get those prolactin levels back up. But there are other things that can be used too. There are herbs, and just different kind of systems, and everybody's got their different styles. And that's why I would recommend reaching out. And if you're considering something like domperidone, there are some risks to it, and there are some people who shouldn't use it. So I think that it is important to reach out to a professional who has a little bit of knowledge about it to help to guide you.
Thank you for that. Of course, these are medical suggestions. As she's emphasized, please reach out to your lactation specialist to discuss what's best for you, because that may not be the best choice for you as well. Thank you so much. Now, my last myth to bust is, if you're breastfeeding, you spoil your baby. That has been said quite a few times, like breastfeeding spoils the baby. What would you say to that?
Well, my mother, who is a child psychologist, would say to me, if I said that, you cannot spoil a baby. So babies need us. They are dependent on us, and they need nurturing and love to become the people they are going to be. And it has nothing to do with spoiling at this point. I mean, kids can be spoiled. I'm not saying that that's not possible, but breastfeeding does not do it. Breastfeeding is a combination, a lovely combination of nutrition, feeding your baby, one of our number one jobs as a parent, and nurturing. And it is, there's absolutely nothing that spoils a baby about it. I don't even know how to say it any differently.
No.
Spoil your baby by breastfeeding.
Breastfeeding does not spoil your baby. That's nutrition. Feeding your baby does not spoil your baby. Very important. This has been so good, Doc. I learned a lot. I was taking notes. That's why you see me looking down, taking notes as well, because I'm learning. And I forgot to mention earlier, if you're watching live, hashtag live. If you're watching a replay, hashtag replay. Please share this with those who may be expecting or planning to get pregnant, and this could be useful for them, or who are actively in the process of breastfeeding. But Doc, I want to share you with the world. Okay. So for those who are watching, who are like, I like this doctor, I want her to come speak maybe at a program or an event I'm having to talk about breastfeeding and to highlight the importance of it, or they want to connect with you where you are as their physician. Doc, where can people find you?
So, in a few ways. Number one is probably my website, which is www.intouchpediatrics.com. But I'm also on Facebook and Instagram, and you can link to all of those things from my website. I also have a YouTube channel where I do interviews similar to this one to get lots of information from other people doing interesting things out there, somewhat heavily based on the kind of breastfeeding postpartum space, but not completely. And then I also have lots of little tidbits there about just tips on breastfeeding and general pediatrics as well.
Awesome. Thank you for what you do. What you do is a big deal. So I appreciate you for coming. And we've already put those comments where people can reach out to you in the comment section, so people can connect with you. Thanks
Great.
again, Doc.
Thank you for having me. This has been a joy, and I hope that some people get something out of it that
Oh, they
helps
will.
them.
Oh,
And
they will.
just knowing that there are people out there who can help you. I'm happy to help somebody find somebody like me in their local area if they need it as well.
Awesome. Awesome. I appreciate that. Thank you, Doc.
Mhm.
Thank you.
Absolutely. All right.
And thank you all for watching live. I'm sorry I can't see all the faces, but I want to highlight Ms. Brown. Thank you for asking that very, very important question. Please share this. Just simply forward this link to them or tag them in the comment section. And if you or anyone you know is looking for an awesome, a thorough, and a passionate family physician who will help you live long and well, and we have conversations in that regard, I am she. Have a good. Thanks again, Doc.
All right. Thank you. Have a great day.